Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes, and today we are just doing an experiment. Let's see whether it gets better or not, but always experiment. Even while you are preparing for a very serious test like OET, where concentration is the most important thing, then also relax your mind, just try to execute things in a random way. Suppose if I'm uh sitting in a bus traveling to some place, so I will put my headphones on. I will go to my Google Chrome or Safari, whatever you have according to your respective phones. So I go to simple YouTube. So I would type over here www.youtube. That's it. That's the only thing I will do. And I'm traveling. Otherwise, suppose I'm cooking or I'm doing something else. So that is what mindset is all about. If you want to prepare the best for the listening, so you go and you say anything. OET listening, that's it. So you type this thing and let's say you play any listening. Don't worry whether it is difficult or easy. If it is easy, then if you are doing right questions, it will give you confidence. If you are doing difficult questions, you will understand that there are few questions which can be wrong in the final exam. So don't take stress. Please do not take stress of difficult questions, because out of 500 or out of 42 questions, we want 32 questions to be right. It can be 30 if the listening is difficult. It can be 34 if the listening is easy. Normally 32 is an average to pass OET exam. And considering the part A, if we have got 24 questions, so obviously there are high chances to pass. So I'm just going to play this listening now. And so I don't know whether this listening is good or bad. I just simply went and I'm going to, so simply let's see how does it go. I'm just going to take it just like that. So you play listening.
Can you tell me your name and age?
And suppose you do not have pen, you do not have paper, you have nothing. So you are traveling in a bus, having a mobile phone in your hand, and or you are cooking, having headphones, but your hands are occupied. Still, you can practice listening. Is such a wonderful thing. So let's see.
Please?
My name is John and I am 55 years old.
Thank you, John. Do you have any past medical history that I should be aware of?
Yes, I have a history of hypertension and diabetes.
Okay,
Hypertension,
thank you.
hypertension and diabetes is my answer. So I don't have to check. I don't have to write even. I am practicing listening just like that.
There any history of spinal problems in your family?
No, there is not.
All right. Have you had any allergies to medications or anything else in the past?
No, I have not.
Thank you. Can you describe the symptoms you are experiencing and when they started?
Sure, the back pain started a few weeks ago and has been getting worse. The pain is located in my lower back and it radiates down to my legs. I also feel
So radiates down to my legs. This blank I could fill. Numbness in the leg for maybe that was back pain and numbness in the legs for a week maybe, but I did not pay attention. But when I see this blank, so you have to estimate that blank when you get 90 seconds in the start to prepare. So you can estimate that time can fit in back pain and numbness in the legs for 1 week, for whatever. I did not pay attention, so I will pay attention again.
Have you had any allergies to medications or anything else in the past?
No, I have not.
Thank you. Can you describe the symptoms you are experiencing and when they started?
Sure, the back pain started a few weeks ago and has been getting worse. The pain is located in my lower back and it
So for few weeks, that is the only answer I can find. If this blank goes wrong, I will not worry. For few weeks, I will write it down. Pain radiating down to legs, wo to pain in lower back radiating down to legs. So I don't need even pencil. I don't need even paper. I'm practicing my listening. So then I go.
it's down to my legs. I also feel some numbness and tingling in my legs.
I
So
see.
numbness and tingling in my legs. So that is how simply you can prepare for OET listenings. Just go anywhere. Suppose, oh yeah, I'm not happy with this listening. So don't stick on to one listening. When it comes to part A, practice as many. Suppose if I go to this link, this. So I open this link, I play it over here. That's fine. Okay, let's play.
Self. Then on top of that, I began getting quite a few mouth ulcers, and they're really sore. Ugh, and something else.
Sore means painful. So maybe mouth ulcers. Mouth ulcers can fit in. So I'm doing it randomly, like I'm not giving myself time. I just want to practice more and more. So listening, make it fun. So sore, sore means painful. So painful, this thing. Now increase number.
I've always gone regularly to the dentist and, well, I used to have the odd filling, but now she keeps finding dental cavities, so I'm always having them done.
I see. And does your mouth feel dry?
Yes.
So
I'm
increased number of dental cavities, that is what she has said. So increased number of dental visits. But it is not, it can be dental visits because she has told about two things have increased: dental visits, dental cavities. But when I am talking about symptoms, I would like to talk about dental cavities. So that is what you need to understand. She is going to dentist more, but but I have to talk about symptoms. So symptom is dental cavity, dental caries. So that was the word. Again, I will tell you what I am saying. Now I will play
It'd be
it.
helpful if you could tell me in your own words about the problems you've been having.
Well, I've been having various symptoms recently. Apart from generally feeling tired, I've started noticing how chapped my lips were. I'm always using lip salve. Then, on top of that, I began getting quite a few
Sorry.
mouth ulcers. And they're
Mhm.
really sore.
Painful ulcers, painful mouth ulcers, or painful ulcers. Both are correct. Both are correct. So you don't have to worry. Or painful ulcers. Ulcers is the word they are trying to find. Mouth ulcers, even then it's fine. Painful ulcers.
And something else. I've always gone regularly to the dentist and, well, I used to have the odd filling, but now she keeps finding dental cavities, so I'm always having them
You know
done.
the spelling of dental cavities. Dental cavities. Cavities. So if you're listening, see, you have got 24 questions in the part A. So try to get this 22, 23 right in the part A only and finish the game of listening. Don't get dependent upon listening part B and C. Finish it in the part A. So practice lot of spellings, lot of different listenings. Keep practicing, and you don't have to write it even. Why are you wasting time in writing in the part A? But yes, you have to practice it fast so it can be good. But when you do not have the resources, you are traveling in a bus, rather than thinking negative, we can work upon these things. It is so easy to work upon these things. So then tongue appears.
I see. And does your mouth feel dry?
Yes. I'm always sipping water to try and help,
Mhm.
but it doesn't really. And my tongue started hurting. I noticed in the mirror it looks, well, cracked is the way
Cracked. It appears cracked. And that is one thing I am telling you, the most important thing. What the doctor will say is not the symptom. What patient will say is the symptom. So cracked is the word I would like to fill because tongue appears cracked. Let's see if I
describe it. My whole mouth feels different.
And you've had some eye problems too, I gather.
So that is what you need to understand. Even if doctor repeats something, but I have to fill the symptoms. Symptom would be told by the patient. So try to understand these things. So these all blanks would be filled by patient, and recommended test will be filled by the doctor because he will recommend the test. So then I will concentrate upon his voice. So that is also what you, small things. It's very small thing when it comes to listening. Very small things. Now let's go to part B and part C. Let's do one of the questions of part B. So randomly I'm taking. I'm not worried about anything. Just randomly. I'm practicing. I have time. I'm traveling in a bus. I think that why to do all the questions? Let's do only one question. Suppose I'm traveling, I can do only one question. Why to take every time you have to focus and make everything sorted? Try to maximize your time. With when you are sitting idle or thinking negative, it's better to do one question. So let's do one question. Let's see which one it is.
So who's next?
The patient in bed 12,
Mhm.
she had a fall at home about a month ago, but she's otherwise independent with her day-to-day activities.
Mhm.
Her falls risk is high given her recent history. She's been assessed by the physio, and she's on a rollator frame to ambulate. Her skin integrity is intact, and she's responded well to all treatment.
Good.
She's on a normal diet.
Mhm.
The observations were last done at 6 a.m., and they were stable. Her medications are IV tazocin due at 2 p.m.
Mhm.
and prednisone next due at 8 a.m. tomorrow.
Okay.
You need to check with the doctors today whether she'll continue with the IV antibiotics and whether the cannula can be removed.
Mhm.
At this stage, they're aiming for discharge in a couple of days' time, pending discharge from the physio and also ceasing IV antibiotics.
Okay, thanks.
And now, I don't know which question it is. Sometimes you need to, again, you have to play with listening. So let's see which, first of all, I will try to find which question is this. So I feel like maybe you're nursing feedback, nurse receiving feedback from her tutor about the ward round she has just completed. What would have improved the nurse performance? No. You hear a hospital nurse briefing a colleague about a patient with COPD. What does he want his colleague to do? Encourage greater mobility, medical team. So this can be most probably the thing. I think this question should be anyhow question number 27. Let's see any other question. So this will increase your analytical thinking. Sometimes you need to play with it. You hear two hospital managers talking about a training session for the people who do voluntary now. Who hears pharmacist now? So this might be my blank. Now my blank 27th is the question that I should do. Let us concentrate on the question now. You hear a training nurse receiving feedback from her tutor. What would be the improved nurse eliciting, or it can be 27th. Maximum chances 27th, minimum like bit of is 26. So what would have improved the nurse performance? No. What does he want the colleague to do? Let's listen to it again. What does he want the colleague to do?
Diet.
Let's see.
The patient.
Let's see. Now I will concentrate. So I'm just kind of creating my mind. I'm making it to face more challenges. I'm not scared. So you don't have to be scared. You say, I will take more challenges in an interesting way. Even if my question is wrong, that's fine. At least I will learn something. So now I will play.
So who's next?
The patient in bed 12.
Mhm.
She had a fall at home about a month ago, but she's otherwise.
But fall at home, but this is like COPD. Fall at home should be different. You hear a consultant talking to a woman whose father has just been no, this cannot be the question. Pharmacist, surgeon talking to a member of his team finishing a surgical process. The surgeon, this can be the question. To look an appropriate bed, or maybe let's see. Now this is interesting. I don't know whether it is 27th or 20 or 30th even. 30th is also a possibility.
Dependent with her day-to-day activities.
Mhm.
Her falls risk is high given her recent history. She's been assessed by the physio and she's on a rollator frame to ambulate. Her skin integrity is intact and she's responded well to all treatment.
Good.
She's on a normal diet.
Mhm.
The observations were last done at 6 a.m. and they were stable. Her medications are IV tazocin due at 2 p.m.
Mhm.
and prednisone next due at 8 a.m. tomorrow.
Okay.
You need to check with the doctors today whether she'll continue with the IV antibiotics and whether the cannula can be removed.
Mhm.
At this stage, they're aiming for discharge in a couple of days' time, pending discharge from the physio and also ceasing IV antibiotics.
Okay, thanks.
30th?
Question 28.
28. So 27th was the question. At last, I see that is, even this is an interesting thing to use your mind in a different way. That this question can be this question. What does he want his colleague to do? Encourage greater mobility. I'm not quite sure mobility was said or not. Organize a visit by the consult with the medical team. I think that should be the answer. Now, I would like to listen to it once again. Now I would like to find the answer, because now question number 27th is my real question. So the question is about a patient with COPD. What does he want the colleague to do? Let's see again, last time. Now I would like to find the exact answer.
So who's next?
The patient in bed 12.
Mhm.
She had a fall at home about a month ago, but she's otherwise independent with her day-to-day activities.
Mhm.
Her falls risk is high given her recent history. She's been assessed by the physio and she's on a rollator frame to ambulate. Her skin integrity is intact and she's responded well to all treatment.
Good.
She's on a normal diet.
Mhm.
The observations were last done at 6 a.m. and they were stable. Her medications are IV tazocin due at 2 p.m.
Mhm.
and prednisone next due at 8 a.m. tomorrow.
Okay.
You need to check with the doctors today whether she'll continue with the IV antibiotics and whether the cannula can be removed.
Mhm.
At this stage, they're aiming for discharge in a couple of days' time, pending discharge from the physio and also ceasing IV antibiotics.
Okay, thanks.
So it doesn't seem like 27 should be 100% C as far as I think. But I don't know. I'm generating that curiosity to see the answer. I don't know why. But 27 C. So even my estimation that it is question number 27, even my estimation otherwise, even before listening to this time, was like, if I would have done, most probably would have done C, because mobility I did not hear, because the patient was doing activities independently. So how do you eliminate option A, that when he said that now he is moving himself independently, he is encouraging activities by himself, so that means he does not need any encouragement for mobility. Dietitian word was not spoken at all, so the only answer was C, to consult with the medical team that they are having this medication. You need to consult with the doctor whether to remove the cannula or to give IV. So that is how simple the question was. 27C was very simple. So these are the easy questions that must be right. Suppose if you have got 22 in part A, if you work hard and get 22 in part A, and then out of this B part, if you get 3 or 4 right in this part, so 22 is equal to 26. Now you will have 12 questions in the part C. Out of 12 questions, you just have to get 4 or 5 right. So that is how your calculation should be. So try to understand 24, 22. Out of this, if you can get 4, 26, and then 4 in the part C will make 30 anyhow. And out of the wrong questions, the 8 questions which we are not counting in the part C, maybe one guesswork will go right. In the part B, 5 can be right. So you have to work for those numbers. Let's do one more question. This was an easy question. So let's see 28, whether it is easy or difficult. So I will keep practicing. Again, keep practicing. Let's see question number 28. You hear 2 hospital managers talking about a training session for the people who do voluntary work with the patients. What do managers think about the course?
So we've talked about the
Even before I listen to the recording, I will focus on these words like too few. Too few means very few, means very less. Very less number of people attended, second form. Very less number of people attended to make it worthwhile. Worthwhile means to make it worth, means precious type of thing. Like to make it at least if I say this mobile is worth the money I have paid. So in the same way, worthwhile means it was productive, it was efficient. The content may option has a high chances to be correct. High chances to be correct. May option, whether in reading or in listening part C, may option has a very high chances of being an answer. So what do managers think about the content may need revising for the future sessions? So may need revising, that means the content has to be revised again, means changed again, maybe something. Revising always, revision means two things. I want to revise something, or revise also means to change something. So the content may need changes for the future sessions. The feedback from the participants was not encouraging, so means the participants were not happy. Now I think I have 3 possibilities about the course: that very less people attended, or content may need revising, or the feedback of the participants was not encouraging. Now I will listen to it. So by the time he's speaking, I'm trying to figure out good words like too few, future sessions, and feedback from the participants was not good. So by that time he speaks, I try to figure out these 3 things. What is the meaning of these 3 options? So let's see what do
various things that might have caused your father to collapse. A lot of times we investigate multiple symptoms so as to rule out any life-threatening conditions.
So it could take some time to get to the bottom of the problem.
Possibly. In the meantime, he's quite stable now, and we're encouraged by the progress that he's making.
Well, I'm glad to hear that.
Sorry.
Now read the question.
Sorry.
Doing your manual pulse.
Yes, the pulse was quite strong. And read.
Patient's details are correct. You put the date in, you timed it correctly.
Her skin integrity is intact, and she's responded well to all treatment.
Good.
She's on a normal diet.
So I'm doing question number 28, sorry.
Confidentiality, that kind.
It's quite a lot to ask.
So how do you think the volunteer training course went?
Well, we had a reasonable turnout, considering that these people already give up their free time to drive.
We had a reasonably well turnout. I think that means that many people attended it. So A should not be my option. Let's see. Let's listen to it again. So elimination is a very good method. So that is where sometimes you guys lag when you have problem in part B and C. You are trying to find the right answer. I am trying to find the right answer, but at the same time, I am keeping my ears open to eliminate other options as well. Let's listen to it again. Let's see.
So how do you think the volunteer training course went?
Well, we had a reasonable turnout, considering that these people already give up their free time to drive patients to appointments, visit inpatients, all sorts of stuff like that.
So that is, she's saying that these people are already occupied going to visit patients, inpatient things, but still they came up. It was a good turnout, whatever the word was. But what I could understand that she was happy that a lot of people attended. I think. Let's see how it goes.
A lot to ask. It's a wonder so many managed to fit in the training too.
And they did seem to get something out of it,
Mhm.
if the feedback sheets are anything to go by. From my point of view, though, I just wasn't sure whether it went into issues like customer care, confidentiality, that kind of thing, in enough depth.
Well, that's something we can always look into before we roll out any more.
Well, I think we should.
So that is what he's saying. I think there was something missing, that thing was missing. And she's saying that we should work out little more before we make the next session. Now listen to this line again. So B should be my answer. Let's listen to this again.
And visit inpatients, all sorts of stuff like that.
Mhm.
It's quite a lot to ask. It's a wonder so many managed to fit in the training too.
And they did seem to get something out of it,
Mhm.
if the feedback sheets are anything to go by.
Sorry.
Already give up their free time to drive patients to appointments, visit inpatients, all sorts of stuff like that.
Mhm.
It's quite a lot to ask. It's a wonder so many managed to fit in the training too.
And they did seem to get something out of it,
Mhm.
if the feedback sheets are anything to go by. From my point of view, though, I just wasn't sure whether it went into issues like customer care, confidentiality, that kind of thing,
I think it didn't went into the issues like customer care, confidentiality. So the topic was not up to the mark. The content was not up to the mark.
enough depth.
Well, that's something we can always look into before we roll out any more.
Well, I think we
So
should.
that we can look into before we roll out any more. Roll out means before we give more lectures, before we roll out any more, it's important to look into this thing. And let's see any other option. That's it. So again, 28, then it's done. Yeah, then
Question 29.
so then answer should be B according to me.
You hear a pharmacist.
The only risk can be it might be A. Maybe I did not listen to it well because I have confusion whether too many people attended. But C should not be my answer as far as I think. And she's saying that so it should be B anyhow, as far as I think. I don't know, but still I would like to check it out. 28th is B. So that is how simple it is. So I'm teaching you. That is why I'm taking time. Otherwise, it's just I'm practicing one question, second question. I leave 29 question. I go to 30 question. I enjoy my listening, and I do not judge myself with complete listening. Even 3 or 4 questions can let me know that I am doing very fine. Why do I need to do 42 questions to understand whether I am a good listener or not? Even if I do 5 questions in a right way, and if 3 or 4 are correct, I would say I'm fine, yaar. I'm all right. So I will take it easy. So that is how you need to give yourself confidence. Sometimes you do not have time. Don't go for complete listening and in a rush, I'm coming, and you are not concentrating. There is no point. Do only 5 questions, get 4 right. You are good to go for your exam. Next day, if you have time, then you give double the time. So it's about mindset again. Please create a positive mindset to work it out. So again, this is very important that you have to fit in everything in your schedule. Then let's go to part C. Now we will do some of part C. Let's see how it goes. So part C. So part B and part A should at least give you 25 marks. If you can score 25 to 26 marks in part B, then part B and A, then you have high chances to pass. So part A and B should be very strong. Part C, even if I will do now, it can be wrong. It can be wrong of anyone. So part C is not the major chunk. So out of 12, even if you can do half right, 6 right in the part C, 6 plus 26 will make it 32. You will pass. So please try to think that way. In the part C, 6 questions can be wrong. It's normal. But if you can do 8 right, that is wow, then you will score 390, 380, 400. So that is how you need to improve the margins. So let's see part C, how does it go?
6. You hear an interview with Dr. Bob Dean, who's talking about a trial he conducted to assess different ways of treating the condition known as tennis elbow.
Okay.
You now have 90 seconds to read questions
So I should know about the topic. Dr. Dean. He conducted a trial to assess different ways of treating the condition. Let's see.
1 to 36.
Now, the most important thing when you are doing listening is to read the questions and understand the topic. So I will read the topic for you. Dr. Dean says that the patient with tennis elbow, 30 seconds, in the physiotherapy program used in Dr. Dean's trial. Okay. So first is Dr. Dean says the patient with tennis elbow. So he is telling something. Second question, in physiotherapy program. Third question, what does Dr. Dean say about the role of smart rest in the trial? So this is my landmark, smart rest, because it is a very different word. So again, I told you the last time, I will focus on the words like tennis elbow. Then the second question will have physiotherapy. As soon as Dr. D says anything about physiotherapy, I understand this question is gone. This question is gone. Then as soon as he talks about smart rest, this question is gone. So you have to calculate the words. You have to remember the words. What did Mr. Don find interesting about the results of the trial? So results is an important word. Then Dr. Dean would advise anyone experiencing tennis elbow for more than 3 months too. So as soon as 3 months is a very important word to notice and to underline. Anti-inflammatories is a way, such as the taking anti-inflammatory. So that means I am trying to understand the topic where I have understood that Dr. Dean will talk about tennis elbow. First will be tennis elbow, second will be physiotherapy program, third would be smart rest, fourth would be result, fifth would be something like 3 months would be an important word, and there would be a trial, and then anti-inflammatories would be my keyword. So I try to remember these words. Now let's see when he plays. So by the time I read this question, now I will concentrate upon first question. Dr. Dean says that patient with may be unaware. So maybe again, maybe is a very important option again. But can is also like maybe. So maybe and can both are important words which can be answers. So because they are difficult words to be eliminated. Because may means probability, can means probability, and even tend to come is also kind of probability. So in this, A and C has more chances. B, I'm not quite sure what is the meaning of tend to. Let's read the sentence. So Dr. Dean says that the patient with tennis elbow may be unaware that they have the condition at first. So in the early stages, maybe people do not know they are having tennis elbow. This can be my answer practically. Tend to come from a remarkably narrow range of occupations. Narrow means broad road. Narrow means narrow. So this can also be my answer because coming from the sports field, coming from this field. So narrow means that people would be coming from a narrow range of occupations like sports, athletics. So these people would have tennis elbow. Can easily avoid the condition by adopting correct work practices. So these are my 3 options. Let's see what is my answer. And then if I get the time, then I also try to read this second options as well. But first is more important at the moment for me. So first, if I can, in the 90 seconds or 60 seconds, whatever the time is given, if I can read all the questions, only the questions, and then if I can read these 3 options, and by the time it starts speaking, I do not have any problem. Suppose if it starts speaking, I do not have any problem. So I should read all the questions and options of the question that I'm going to do. So these 2 things should be done in that time. And even if I tell you now it's not getting played even now.
A recent trial led by Dr. Bob.
So you get a lot of time, and even if I close my eyes, first question was what Dr. Dean says. Second question, I do not remember. Third question, smart rest. Second question was 3 months. Last question was anti-inflammatory. And the second, and that I do not remember. Physiotherapy maybe, yeah. Physiotherapy was second one. So this question I could not remember the results. So that means few things will stick to your mind, like again, 3 months, anti-inflammatory, smart rest. So these kind of words will help you to understand what speaker is speaking on which question he is. तो दिस थिंग इज वेरी इंपॉर्टेंट. आपको पता लगेगा वो कौन से क्वेश्चन पे है, कौन सी जगह पे है. सो दीज थिंग्स आर वेरी 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 इंपॉर्टेंट. ओके, सो लेट मी डू दिस नाउ.
The condition commonly called tennis elbow is a painful condition of the tendons which interferes with tasks involving gripping and manipulating objects. A recent trial led by Dr. Bob Dean has tried to see what type of therapy works best. Bob, is there a typical way that tennis elbow starts?
It's a very common condition, but apart from tennis players themselves and people working in industries where they do certain manual tasks, it's surprisingly difficult for patients to pin down the actual start of the pain. And even with the...
So people working in particular sectors will not be able to pin down. Means they may be unaware. So this can be one of the answers. Let's see if others can be ruled out or something.
high-risk activities, it's generally something that comes on over a period of time. In tennis, it used to be said it was down to the player's grip or the type of racket they were using, but nobody's really researched that thoroughly. There are plenty of guidelines out there, but they're not evidence-based. When somebody has pain, then modifying their tools, whether that's a tennis racket or something at work, may well help, but that doesn't necessarily mean there's a causal link.
So what was your approach?
So I do not know which one is the answer. I feel A, but I'm not quite sure about this answer. Obviously, I would love to listen to it once again, and that is what you should have dare for. Rather than going fast, let's listen to it again so that I want to learn. So I think it should be A, because he was saying that few occupation people are unable to understand. Then I can eliminate as well, because it's only for the few people. But that is why maybe is an important thing. क्योंकि यहाँ पे maybe दिया हुआ है. Maybe means शायद कभी कभी नहीं पता लगता. Maybe unaware. So maybe word has actually again intrigued me. Otherwise, B can also be the answers. But again, he did not say it happens only to the narrow range of occupations. He said these occupations are unable to find when the pain is. So let's see again.
See what type of therapy works best. Bob, is there a typical way that tennis elbow starts?
It's a very common condition, but apart from tennis players themselves and people working in industries where they do certain manual tasks, it's surprisingly difficult for patients to pin down the actual start of the pain. And even with those high-risk activities...
So apart from the tennis elbow and other professions, it is hard to pin down the mistakes. Means if you are a doctor, if you are a nurse, if you are other fields which do not require a lot of activity, it would be difficult for you to pin down the pain. So maybe unaware that the condition has first, but let's see if other options are spoken.
It's generally something that comes on over a period of time. In tennis, it used to be said it was down to the player's grip or the type of racket they were using, but nobody's really researched that thoroughly. There are plenty of guidelines out there, but they're not evidence-based. When somebody has pain, then modifying their tools, whether that's a tennis racket or something at work, may well help, but that doesn't necessarily mean there's a causal link.
Again, now the word of elimination that I would love to teach. If the answer is A, first of all, let me check the answer. Otherwise, I will teach you wrong. Sorry, it's just I'm teaching, so I want to be sure before I teach you something. So 31st should be A. Very nice. Now I will tell you the reasons. Please understand how simple the logic is. So if you will understand what I mean by elimination, so 31 is my direct answer. Obviously, I don't need elimination. But if I eliminate, then the people out of you who are my old students and now who are new ones, please understand words like remarkably and easily. LY words are very important because they are easy to be eliminated. Remarkably means too much, too narrow option. Too narrow. Remarkably narrow means he should have spoken something like they come from a very specific field, they come from a very narrow fields, means बहुत ही कम field में होता है ये. But he said that apart from the people in the tennis or doing any athletic or industrial work, these people, otherwise people are unable to find when it starts. So that was the main thing. So it is happening in everybody's case, but the most of the people are not recognizing this pain at first. Remarkably word was not spoken at all that they are coming from only this field. So remarkably means बहुत ज़्यादा narrow, very narrow. So this he did not speak. And if you understand this easily word as well, can easily avoid the situation. He did not say avoid word, but easily word, so I am 100% sure he did not speak. So these are the easy words for elimination. Even in the reading, I'm telling you, these are the words to be eliminated and these are the words to be picked, maybe. Now, if I have to say this, in this case, some word would be very important for me. Passive voice, the treatment given was tailored to the needs of each. Each word would be very special for me. So these are the words I pick. Each means every patient. That treatment was tailored. Tailored means like when we give you online classes, so we provide you an individual teacher who work according to your mistakes. So this is tailored. Like if I stitch my shirt, if I get my shirt stitched, I will go to a tailor. So tailor-made means according to my size, according to my requirements. So tailor word is like individual. Tailor word is like the exact word to tailor is customized, that we work according to customers. So the treatment given was customized to the needs of each patient. So now each patient will play a very important role. That is it different for different patient and all the patients are treated. So each word can be replaced by every, all. So this word must be there, otherwise this is out. So more chances of elimination. Some patients found the treatment too painful. Two word is also important. Two means very painful. So this is an important word. And some patients found. So it has little bit more chances because only few people, some people means some found painful, some found okay. Patient had to build up their strength before starting it. So let's see what is the right option and I will play it. This is one last question we will do to understand how to pick up the option and whether this option is going for elimination or not. Patient had to build up their strength before starting it. Okay. Let's see. Here is it. What is happening?
We should.
Hmm.
I don't know.
Tennis elbow is a painful condition of the tendons which
There's lapse in the voice in between, right?
a condition commonly called tennis elbow is a painful condition of the tendons which interferes with tasks involving gripping and manipulating objects. A recent trial led by Dr. Bob
Start of the pain by itself, the wait and see group, we called them, and people in the third group were given steroid injections. The book may well help, but that doesn't necessarily mean there's a causal link.
So what was your approach in the trial you conducted?
That is,
Well, we divided our patients into
that
three.
is also an important part of that. They will give you when the other person will ask other question, then the second question would be played. So in this case, you have less chances that you will miss out on 32, 33, 34. Because that patient will ask, that person, the second person will ask some question, then 32 will come. So that is also good about OET listening, that you will not miss out everything in the queue. So this is also a positive point about OET listening. Let's do this last question and then it's done.
Groups. One group followed a physiotherapy program. Another was asked to do nothing to see if the condition just went away by itself. The wait and see group, we called them. And
so they are saying there were two groups until now. One, the people who were given physiotherapy, the people who were given nothing, they wait and see. That to one group physiotherapy was given, other group nothing was given. Let's see if there is any group 3.
Well, in the third group were given steroid injections.
So third group was steroid. So physiotherapy, steroid, and did not give anything.
The physiotherapy we used was a specific elbow manipulation. The therapist applies manual force to the elbow joint, and at the same time, the patient actually performs the kind of task that causes the pain. The aim is to apply the force in a way that relieves that particular pain. But just as important is the physical activity the therapy calls for, because in most tennis elbow patients, their muscle system's quite debilitated.
And I understand that complete rest wasn't seen as an option. Instead, you described something called smart rest.
So this question was fast and I didn't know where did it go. But now I have chances. So somehow if I have to do it, I would do B, because each, he did not say. Some people found the treatment too painful. I'm not quite sure. He's told something that some people have to kind of prepare those things. Again, B or C can be the answer, but each word was not spoken. As always, I would love to do this elimination, but let's see.
To see if the
Let's see if it can.
What was your approach in the trial you conducted?
Well, we divided our patients into 3 groups. One group followed a physiotherapy program. Another was asked to do nothing to see if the condition just went away by itself. The wait and see group, we called them. And people in the 3rd group were given steroid injections. The physiotherapy we used was a specific elbow manipulation. The therapy
Was a specific elbow manipulation. Each specific, these words are very important, but specific words does not mean each over here, because there is specific type of thing was given, but it doesn't say each patient. But let's see more.
applies manual force to the elbow joint, and at the same time, the patient actually performs the kind of task that causes the pain. The aim is to apply the force in a way that relieves that particular pain. But just as important is the physical activity the therapy calls for, because in most tennis...
Just as important, this line I was discussing, just as important, the physical activity it calls for. So maybe it is saying that before starting it, you have to build up the strength, physical activity it calls for. So that is, again, I'm not relying only on this line. I am relying on painful words. So I don't think so painful word has been spoken until now. Each word has not been spoken. So that is why elimination gives me that assurance it should be B. But the line that I want to match is that the physical activity it calls for. That means it calls for a physical activity before you do it. So that is what elimination is. Remarkably, easily, each. These words should be eliminated, and too painful. Too was my word. Let's see if too painful has been said or not. So I will tell you this line again.
The therapist applies manual force to the elbow joint, and at the same time, the patient actually performs the kind of task that causes the pain. The aim is to apply the force in a way that relieves that particular pain. But just as important is the physical activity the therapy calls for, because in most tennis elbow patients, their muscle system's quite debilitated.
And I understand that complete rest wasn't...
So painful word was not spoken. Each word was not spoken. So again, I feel 30 seconds should be. But it says, I don't know, the treatment was tailored according to the needs. This should not have been given. I don't know why is it wrong. I have to listen to it again. The second, the treatment was tailored according to the needs, but it does not say the complete option. This answer I think should be wrong, but I will listen to it again to improve myself. Just the last question we are doing. Let's see what wrong I have done in 30-second question. I don't know.
Is there a typical way that tennis elbow starts?
It's a very common condition, but apart
Just the
tennis,
last-
it used to be said it was down to the player's grip or the type of racket they were using.
The trial you conducted.
Well, we divided our patients into 3 groups. One group followed a physiotherapy, elbow manipulation. The therapist applies manual force to the elbow, and people in the 3rd group were given steroid injections. The physiotherapy we used was a specific elbow manipulation. The therapist applies manual force to the elbow joint, And at the same time, the patient actually performs the kind of task that causes the pain. The aim is to apply the force in a way that relieves that particular pain. But just as important is the physical activity the therapy calls for, because in most tennis elbow patients, their muscle system's quite debilitated.
And I understand that
I
complete
would
rest.
still say answer should have been B, because the only way I can do A answer is because manual word is the only word they are trying to relate, but it should be B anyhow. I will take your feedback as well for this question once I stop the recording. But to the YouTube followers as well, please understand, I still believe the answer should be B, but you can put in the comment box if I have done something wrong. But according to me, manual, obviously manual word can relate to that you are dealing the patients individually. Specific manual elbow rotation, something like that word was spoken. So that might say it is tailored, but patients had to build up their start before word was not spoken, but before word is an important word for elimination as well. But there is a word that he said that physical activity, but physical activity maybe does not mean strength. So again, yeah, this is kind of a difficult question which in exam also can go wrong, but I still believe answer should be B. But now I am confused because before word is not spoken, and but it said it calls for. So calls for means before starting it, obviously. Strength does not mean physical activity, so I might be wrong as well. So elimination is happening even in the B part because strength does not mean physical activity. And A, he did not say that it would be according to each patient. So still I do not believe A. So these are the questions which would be difficult. So you don't have to get what is the exact word I should say? Normally we say don't piss off, don't worry about these. So you don't have to get worried about these questions. Please don't get pissed off with these questions. Don't worry about these questions, please. These questions cannot be right even in the final exam because sometimes you believe it is A, sometimes you believe it is B. So this is not my question if by chance it goes wrong, but this surely should be right, or maybe out of these two, one can be right. So out, that is what I'm saying. Part B and C is having 18 questions. Even if you can do half right and 22 in the first, so you still make 31. Even if you do half right, one right, one wrong, one right, one wrong. And there would be some other easy questions as well, which would be easy. And this question confused me. So obviously, otherwise, I think it should have been B because it did not say each. Each would always be my word of elimination. And before also is an important word which normally I speak about. If you will listen to my other reading videos, before word I always say be careful about this. To word, too painful. So these words like before, to, each, if I tell you about this, certain would be my words. Certain means specific types of tennis elbow. Basis of 2 to 3 treatment, it kept all the patients. So these are the words, it would always be there in the listening, which will guide you what to eliminate. Like in this case, if I tell you again, I'm just the last thing that I'm telling you before we leave this video, that these words would be my main word. Certain. Certain means specific. Kept all. These are the two options I would like to eliminate. If otherwise he will speak about. It was not appropriate for certain types of, so he might speak it is not good for all types of. So it is not appropriate for certain types of tennis elbow. It formed the basis of 2 of 3 treatment options, or it kept all the patient physically active. So all the patient is a very important word to eliminate. Normally saying, I do not know what would be the answer. Generally, it can be A as well. I'm not saying it is 100%, but chances are high. I don't know what is the answer of 33, but I'm not doing it either. It's just because I don't want recording to be too much so that you do not get bored. But if I say so 33rd answer is it kept all the patients physically active. That means this question would be easy because it would be speaking that all the patients physically active. That means all means that it would be speaking in the listening as well, that every patient, all patient. So that will make this option easy. So all word is a kind of an eliminatory word, but at the same time, it is an easy word to be right as well, just because when he say everybody, so that means this is my answer. Everybody needs to be physically active despite the condition. So that should be my answer. So that depends upon this thing. But again, these are the questions you need to, these are the words you need to pick. Certain, all, and these are the words. If I talk about other things, then short term can be my word. an earlier piece of research, but this does not have any keyword normally. This any word. You avoid using any steroid medication. This is an important word to consider. And then try a combination. This is less effective than. So these are the kind of the words which you pick, like any, each. These words will help you either to eliminate or to reach to this answer very easily, because when he will say everybody needs it, all the patient needs it, so this becomes easy. Oh, this is my word. So if it says even one the patient, even if one of the patient is not included, that means it is going in elimination. So all word, each word are very important words to be picked, and they help you. And sometimes listenings are not up to the mark. Like if I talk about the other question which I was saying, the second question which we did, A option was not also correct. B option also had certain problems, but I would still go with B, because B option was like it calls for that physical strength, physical activity before, but strength does not mean activity, so I can rule it out or eliminate it. But then A is also not a very good option, because they did not talk about that every patient was given different thing. But yes, manual word was used and a specific word was used, so that might have triggered him to do A. That manual specific means that each patient was given manual treatment, so every patient was given specific treatment, means it is an individual thing, was tailored individually according to the patient. So it can be, but it is very indirect answer to be done. But second option, if we could eliminate it by saying strength is not the activity, then you might reach to this option, depending upon the mind at that point of time, and luck as well. So luck will play its part, but the simple questions like 37, which I did earlier, 31, that should not be wrong. Part B, we did 3 questions. The easy questions should not be wrong. So that is what it is all about listening. And A, you can practice as much as you want while traveling, while going. So don't make it cumbersome by picking your pencil. I haven't picked pencil at all. I still learned, and I could have done it with mobile phone if I would have been alone, if I would not have been teaching you. So you have the resource in your hand all the time. So try to use that resource and make the best use of it. And don't worry, part B is wrong, part C wrong. Now my 32nd question is wrong. It doesn't make my listening weak. I have to practice it more to make it better. I have to go in detail why this option can be my answer. Like I understood this option can be my answer because maybe physical activity does not mean strength. So this can be the point. And then manual specific word can be. But I know this was a difficult question. So I do not depreciate myself for this thing. I want to learn more. If there is any question that is out of my power, I don't worry about it. So I try to learn, but do not depreciate or discourage myself. And the same applies to you. You should not depreciate or discourage yourself. Always look out for the points of appreciation, point of learning, and that is what it is all about, to learn more so that luck can ride your way. It can help you to pass. So fortunes come to those who want to be lucky. So please try to be lucky and try to be hardworking. So that is how listening will go. Practice at bus, cooking food, washing dishes, practice listening days and nights to make it better. This is Dr. Bhupesh from Dr. BKM Institute. Subscribe and share our channel if you like the video, and always watch the videos till end if anybody is listening at this moment on the YouTube. So please watch the videos till end. You always learn. And yeah, call us for the best OET coaching. Number is +917696734256. Thank you.